Hi guys, it's Tristan here. So now we're going to be doing fever from the age of 4 weeks up to 3 months. So the previous video did from birth to 4 weeks, and now we're going to do the next kind of couple of months up until 3 months of age. So still a high risk age, but slightly less high risk than those first 4 weeks of life where the baby is very, very vulnerable to severe infections. So this is a tough one because guidelines really vary on what they recommend here. So I've tried to kind of distill them down to the things that are common between them and then highlight a few key differences. So we'll go through those now. Now, all the guidelines, like with a younger baby, agree that these kids still need prompt evaluation and discussion with a senior doctor or paediatric colleague. Most of the guidelines, for example, the NICE guidelines in the UK or the Sydney Children's Hospital, will recommend some of these tests if the child is unwell. So they'll say you need to do blood cultures and these should be prioritised. They'll say you do other bloods like I mentioned in the previous video, so full blood count, EUC, and then CRP and VBG. And then they say do a urine dipstick and culture, which again might have to be through a suprapubic aspirate. And then finally, they say usually give antibiotics, although some guidelines will say if the child is well, then you don't necessarily need to give antibiotics if you haven't found an obvious source of infection. Now, the next thing we'll come on to is lumbar puncture. Now, this is where it got really confusing because some guidelines, most of the guidelines mention lumbar puncture in some way or another. Some of them will basically recommend it for all these children. Some of the guidelines I looked at will only recommend lumbar puncture if there's no clinically obvious focus. So, for example, the Royal Children's Hospital in Melbourne or the Queensland Health guidelines both say if you've got a fever and you don't have an obvious focus in this age group, then you do a lumbar puncture to look for meningitis. But if you've got an obvious source, like a urine infection, then you don't necessarily need to do a lumbar puncture. Some of the guidelines, so for example NICE guidelines in the UK will recommend a lumbar puncture for all unwell children who are febrile in this age group, regardless of whether you've got a known source or not. And then the Sydney Children's Hospital has a pretty cautious set of guidelines that says any unwell child gets a lumbar puncture. You also get a lumbar puncture if you've got abnormal inflammatory markers, or if you're deteriorating, or if you've got a positive urine. So unlike the kind of Queensland ones or the Royal Children's Hospital guidelines, they say even if you have a known source of a UTI and you've got positive urine on microscopy, so leukocytes, nitrites, or raised white cells, you still need to do a lumbar puncture because that's a sign that they're going to be more likely to have systemic, infection and sepsis. So it's confusing. I think just go by your local guidelines and don't forget to, consult a senior or ask your paediatric team what the kind of policy is in the hospital where you're working. Now, remember with lumbar puncture also that you can only do it if there's no signs of raised intracranial pressure, and you shouldn't be delaying antibiotics to do things if there's going to be a long delay. So ideally get the lumbar puncture first, but if the child's really unstable and really unwell, you can just resuscitate them and give them antibiotics, and the lumbar puncture can be done a bit later. It doesn't catastrophically ruin the yield of the test, although it's just slightly better if you can do it before you get antibiotics in. So all our guidelines will agree on that. They say if your child is unwell or deteriorating, they need empirical antibiotics and resuscitation, and investigation should not slow those down. Okay, so that one is a bit more confusing than the really young babies under 4 weeks, where basically all the guidelines just say do everything. But hopefully that was kind of useful, and we'll get on to the next topic, which is going to be the pearls and pitfalls.